the outbreak of COVID-19 pandemic in Nigeria, several measures have been taken to curb the spread of the virus.
But most of these measures have not taken into consideration women with disabilities.
As women with disability, we are vulnerable to contacting the virus.
Because we have underlying health challenges and we also need human support on a daily basis.
If our aide or relative is positive, it means we could contact the virus easily.
And as a woman with visual impairment, I depend more on touch, and when I'm touching someone, that means I would have to wash my hands regularly.
All interventions regarding COVID-19 pandemic needs to take into consideration the needs of persons with disabilities, especially women with disabilities.
As a blind lady I am, I touch a lot of things with my hands. I move around with my guide cane. And as a result of this, I need to wash my hands regularly with soap and water. But in the absence of soap and water, I used my alcoholic-based hand sanitizer, as well as sanitizing my guide cane regularly.
Having access to information about COVID-19 is key for me as a deaf person. There is so much information about COVID-19 out there, but I will require this information to be in sign language so that it can be accessible to me. With adequate access to information, I won't fall prey of false information, and I will be able to take informed and appropriate precautions and seek help from the right sources.
My wheelchair is my mobility aid. It makes significant impact with the environment. It is important that I disinfect it regularly to avoid contracting COVID-19 through it.
As a woman with physical disability, I rely heavily on woman support. It is important that I and my caregiver wear our face masks appropriately and regularly. I also need to use my alcohol-based hand sanitizer on a daily basis. Anytime I have contact with my aide or anytime I use my crutches.
As a visually impaired woman, I rely strongly on my aide because I have to hold her hand to enable easy mobility and carry out my day-to-day tasks. It is important for my aide and myself to wear our face masks. Wash our hands regularly and stay safe.
It is important that the health facilities are physically accessible to me when I need to go seek medical attention. Should I suspect any symptoms of COVID-19, I need to get tested.
We would want the government to know that if one of my family is infected with the virus, I would be definitely infected. So we want the government to ensure that the means of passing information to people should be inclusive and should be printed in braille format or in audio form so that we can access it as persons with visual impairment.
Women with disabilities, it is important that we access home-based care, especially when we are asymptomatic. This will ensure that we do not put more pressure on the medical facilities and also expose ourselves to more danger out there.
As a woman with disability who are tested positive for COVID-19, please note it is not a death sentence. Having overcome many barriers as a result of your disability, You can also overcome COVID-19 once you seek medical attention early enough.
While we stay at home and restrict our movement due to COVID-19, we also need to stay safe from all forms of domestic and gender-based violence. We need the support of our family, caregivers, and society at large.
Women with disabilities are one of the most vulnerable to the humanitarian challenges brought about by COVID-19 pandemic. It is therefore important that women and girls with disability play key roles in the design, planning, and implementation of all COVID-19 humanitarian interventions, including food relief, economic empowerment, and social protection services.
COVID-19 is real. Stay safe, stay protected.
COVID-19 is real. Stay safe and protected.
COVID-19 is real. Stay safe, stay protected.
COVID-19 is real. Stay safe and stay protected.
COVID-19 is real. Stay safe, stay protected.
Coronavirus is real. Stay safe and obtain all necessary measures.
COVID-19 is real. Stay safe, stay protected.
COVID-19 is real. Stay safe, stay protected.
COVID-19 is real. Stay safe, stay protected.
Stay safe, stay protected. Coronavirus is real.
COVID-19 is real. Stay safe, stay protected.
COVID-19 is actually real. Please do stay safe.